So is it looking from your end that I am recording?
Yes.
Okay. So I apologize on that. I knew I was going to forget to hit record. So let's go back to just covering the clinical judgment model, because I know there are some people that couldn't make it tonight. So it's recognizing cues. Those are your red flags, things that are jumping out at you that you are going to be concerned about with that patient. Analyzing those cues. So what do they mean? What do they mean for your patient? And what are you seriously worried about based on those cues? And now prioritize your hypotheses. What do you think is going on with this patient? What's the worst case scenario that can happen based on these cues? And then generate solutions. What needs to change with this patient? What kinds of things are you going to anticipate that you need to do to turn that patient back in the direction where you need them to be? And then take action. What are you going to do about the problem? And finally, which is the last step of the nursing process, evaluate your outcomes. Did it work? Do I need to change my plan of care? What can I do going forward? So when we get into critical thinking, we're validating and organizing data. We cannot teach you everything you need to know in nursing school, every med, every lab, every disease process. You need to build on your prior knowledge. Look at that NCLEX question. Look for patterns and relationships. How does it relate to something that you already know? If you're looking at a scenario and it's obviously talking about someone with a respiratory disease that you've never heard of, then think back to all the respiratory diseases you do know about and transfer that knowledge into that new situation. You're going to be doing that on the NCLEX, but you're also going to be doing that for the rest of your practice in nursing, because not every report that you get is going to make 100% sense to you. They're going to talk about a disease you've never heard of, and you've just got to take what you already know and move it into that new situation. So your first strategy on the NCLEX is don't read beyond the circumstances. What is in the question is in the question, and that's what you need to consider. Take the words "what if" out of your vocabulary. If it's not in the question, then it's not a concern. You can't say, well, based on this scenario, well, what if the patient's diabetic? Then I would need to do this or that. If it's not in the scenario, you're not supposed to think about it. And that can be very difficult because you've had a lot of clinical experiences and you're starting to remember patients that you've had in the past. And now you're trying to fit this NCLEX question into a scenario that really doesn't fit. Read every word in your question. Focus only on the question. Look for key words that will point you in the direction of where that question is taking you. Read every single choice or option. One of them may jump out at you as looking really good, but don't just pick it. Read every option because there might be something that's better. Just focus on what the question is specifically asking. So on the next slide, we're going to do a practice question. So when you go into your Pear Deck session, the question will pop up and you're going to pick the number of the choice that you pick on this. So we have a client with metastatic cancer receiving a continuous IV infusion of morphine sulfate to alleviate pain. Select the adverse effect or sign of toxicity for which the nurse monitors the client: dizziness, nausea, skeletal muscle flaccidity, or sedation. So those who may have come in late, to participate in the interactive questions, you need to go into your browser on your phone and type in joinpd.com, and then you'll enter this 6-letter code when you get in there, and you'll be able to see this in your browser. So we have a nice little variety of answers here. So let's talk about them. Can anybody tell me, open up your mic and say what you think the key words are in this particular question? Yeah, I'm not hearing any comments, so I will kind of move on because I want to make sure we get this done. So the keywords in here are adverse effect or sign of toxicity. We're not looking for a side effect of morphine. We're looking for an adverse effect. So you'd expect dizziness if you give somebody morphine. You would expect nausea if you give somebody morphine, because when you're dizzy, sometimes you get nauseous. You expect your patient to have sedation when they're on morphine. I've had patients fall asleep while I'm pushing morphine. But you're not going to expect, as a common side effect, skeletal muscle flaccidity. That's where the patient's laying in bed all floppy with no muscle tone. That's an adverse effect or sign of toxicity. So remember to look at where that question is leading you. Remember, the people who write these questions are a little sick and twisted. You got to be a little sick and twisted to be sitting in a room for 12 hours writing questions for nursing students to have angst and agita over. So you have to figure out what direction they're going into when they're writing these questions. So let's look at another strategy. Look for keywords. Focus your attention on keywords like early or late, or the best, or the first, or the initial, something you're going to do immediately, what is most likely to happen, what is least likely to happen. Look for those kinds of words. In therapeutic communication questions, what's the most appropriate thing that you could say in scenario? What's the least appropriate thing to say in the scenario? So those are going to help you pick the best answer for that question. So let's do another one. The nurse is caring for the client who has just returned from the recovery room after undergoing abdominal surgery. Select the early sign of hypovolemic shock for which the nurse monitors the client. Decreased deep tendon reflexes, increased pulse rate, increased depth of respiration, lethargy. Okay, so we've got a little bit of a variety. Usually about 3/4 of the people got the answer correct. So the keywords in this question are the early sign of hypovolemic shock. An early sign of hypovolemic shock is going to be an increased heart rate. The decreased reflexes, lethargy, those are going to be later signs of somebody that's going into shock. Increased depth of respiration, probably not. Your respirations are going to be shallow. The rate will be increased, but not the depth. Okay, guidelines to prioritizing. The vast majority of those NCLEX questions are going to be, what is the best or the first or the most important thing that you need to do here? ABC's airway, almost always the first priority. And I say almost because if airway doesn't apply to that scenario, don't pick it. The sick and twisted people who write these questions know that you've had ABCs drummed into you from day one. So they're going to throw a breathing or an airway option in there. And if you're not critically thinking and say, does this apply to the scenario, then don't pick it. Maslow's hierarchy, physiological needs, safety, all of those are going to be a higher priority than psychosocial needs like anxiety and body image. While they're very important, they're not the most important when it comes to your patient. It's the physiological needs. Steps of the nursing process. Prioritize in order of nursing process. Assessment is the first step of the nursing process. So that's where you should go rather than jumping in and doing something first. Get more information. Systemic over local. So things that are more systemic, that are not localized, things that are life-threatening versus things that are not life-threatening are going to be your priority. You need to know the acute versus the chronic manifestations of the disease processes that we're teaching you. What is the chronic state for this patient who has congestive heart failure? And what are indications of the acute exacerbation of that? Actual versus potential problems. Fortunately, on the NCLEX now, they're not asking you to prioritize nursing diagnoses. So you don't have to worry about those NANDA nursing diagnoses being tested. However, you do need to focus on what are actual existing problems with your patients, and those are the priority versus some of the risks and potentials that could be lurking in the wings. Yeah, we've got to think about those, but right now we have to address the actual current problem that's going on. Look for trends rather than focusing on transient findings. Trends would be if you've got an increasing blood pressure or decreasing blood pressure, increasing heart rate, not just an isolated heart rate or blood pressure. I'm going to pull up the chat just to see. Okay. Some people are not able to get into Pear Deck. So, okay. So you need to look at signs and symptoms of emergencies, complications versus expected findings, and also look at how much time has elapsed. The most recent incident, surgery, admission, exacerbation is going to be the most critical and make your patient most unstable. Be very careful when some test taking products will tell you, pick the least invasive option. You have to be really careful with that. You've got to make sure that that least invasive option could actually help the problem at hand. Just because it's the least invasive doesn't mean it's the best answer for that situation. So just be real careful on that. Is that least invasive option actually going to help my patient? And ask yourself that before you pick it. So here's another question. What's the priority intervention for the patient experiencing chest pain and a pulse ox of 86%? Administer morphine, administer oxygen, administer nitro, obtain an EKG. Great. Everybody said administer oxygen, because sometimes people get kind of focused on the fact that the patient's having chest pain, because it is very important. Patient having chest pain, they could be having a heart attack. But the pulse ox of 86 is testing your knowledge of what the ideal pulse oximetry should be, which is 95% or better. So administer oxygen. We have an airway problem as well as a pain problem, but we need to get that oxygen level up. A client with cancer is receiving morphine sulfate 10 milligrams sub-Q every 3 to 4 hours for pain. Select the priority action the nurse includes when preparing the plan of care for the client. Encourage fluid intake. Encourage the client to cough and deep breathe. Monitor stools. Monitor urine output. Okay, so we got a half and half. Now, when you look at this, actually, you're going to do all of these things when your patient, these are all going to be part of your plan of care with the patient getting morphine. But what do you know about morphine that you need to be really concerned about? The fact that it depresses respirations. So encouraging the patient to cough and deep breathe is going to be your priority action. Yes, you are going to encourage fluids. You're going to monitor stools because they're going to get constipated. You're going to monitor urine output. But coughing and deep breathing is going to be a priority because this particular med depresses respirations. If I was talking about a different medication that didn't impact breathing and there was nothing in the scenario that said the patient had any kind of a respiratory risk, then maybe you'd need to look for something different as your priority. Okay, prioritizing using assessment. First step in the nursing process, it is best to select the option that contains assessment or collection of data. So if there is an option to collect more data, gather more data, get more information, then pick that first in an NCLEX question, unless you have an emergency. And in an emergency situation, it may endanger the patient to take the time to gather more data, and you may need to jump in and do something. So you have to be able to use your critical thinking, your clinical judgment to determine if that scenario is describing an emergency, or if that scenario allows you to take the time to get more assessment data before you decide what to do, what your intervention next step is going to be. We have a 19-year-old patient presenting with acute asthma, respiratory rate of 44, is in respiratory distress. What's your priority action? Conduct a respiratory assessment, administer a bronchodilator via nebulizer, apply a cardiac monitor, provide emotional support. Yeah, I said you all picked it. I know there's some people in here that have had this in class. So in this particular case, conducting a respiratory assessment is a waste of time. This patient is in acute distress. We need to open up the airway immediately. So in this case, you are not going to take the time to conduct that respiratory assessment. Okay, analysis, that step of the nursing process where you need to understand the principles of the physiologic response and then interpret the data. So that is where you are going to be basing your decisions on what you know the normal anatomy and physiology is, the normal lab values, what changes in lab values might be occurring when a patient has a particular disease process. And then once you're able to analyze all that information, then you can determine what you're going to do in terms of your interventions. So let's take a look at this one. The nurse is reviewing lab results from an infant with hypertrophic pyloric stenosis. Select the laboratory finding the nurse would expect to note in this infant. And the normal ABGs are pH 7.35 to 7.45 because yay, in next-gen NCLEX, they're going to give you the reference ranges for all your labs. You don't have to memorize them anymore. The partial pressure of CO2, 35 to 45, partial pressure of oxygen, 80 to 100, bicarb, 22 to 26. So what would we expect to note in this infant? A blood pH of 7.3, a bicarb of 19, a pH of 7.5, or a PaCO2 of 35. Oh, we got a nice little variety on this. So let's look at this. Let's pretend we don't know, because some of you may not know, because you haven't had OB and PD yet, hypertrophic pyloric stenosis. So you encounter this on an NCLEX question, and you're going, oh my gosh, what is that disease? I have no clue what it is. I've never heard of it before. Now you need to dig into your knowledge of anatomy and physiology and medical terminology and that sort of thing to try to maybe figure out what that might be talking about and give yourself a fighting chance on the question. Because with the NCLEX, because it is computer adaptive, it is not recommended that you do a wild ass guess and just, toss a coin and move on, because you have to prove to the computer that you know your stuff. And if you keep guessing on questions and you drop below that invisible psychometric line that says that you know your stuff and you stay down there for too long, they're going to shut off and they're going to tell you that you failed the NCLEX. So let's look at some medical terminology. Hypertrophic means that it's swollen, it's enlarged. You've heard of the pyloric sphincter. It is a sphincter at the base of the stomach that allows food to empty from the stomach into the small intestine. And stenosis means a stiffening or a narrowing. So we have a baby with a very enlarged, swollen pyloric sphincter that is stiffened and narrowed. And so it's not going to be able to move and allow that, open up and allow that food to go into the small intestine. It's going to just keep accumulating in the stomach. And then all of a sudden that baby's going to start throwing up and we're going to have projectile vomiting. So think about what happens when you throw up, anybody throws up, you're losing whatever food, formula, baby, breast milk that might be in that baby's stomach, but also you're losing acid, gastric acid. So when you lose acid, you're going to go into alkalosis. So your critical thinking, your judgment here, using all of your knowledge of anatomy and physiology and terminology, you're going to pick the pH of 7.5 because you know that anything greater than 7.45 indicates alkalosis. So we have a patient that's in metabolic alkalosis. That's how you can answer those questions where you don't have a freaking clue what they're talking about. Focus on nursing actions versus medical actions. On the NCLEX, all the options that they give you and the way the question is worded, you will have orders for them. But you have to be really careful, because if there is something in that question that is telling you to do something that is really a doctor's order, that only a doctor can say that, like recommending a medication, if you're not licensed to prescribe, that is not your scope of practice, then that's not something that you can do. But if there are nursing interventions that you're having to choose from in that NCLEX question, you have orders for them. Focus only on the client in the question. Answer as if this person is your only client, which is not real world. Answer from the textbook perfect point of view, which means that even if you had this particular medical condition and you had a specific symptom, that at the same time, it doesn't mean that it is a textbook symptom for that disease. So you have to take kind of, well, grandma had this when she had her gallbladder problems. Well, that might not be a textbook sign or symptom of gallbladder problems. Grandma had it. So also remember, in NCLEX land, you are the only nurse in the room. You have to do everything that's in that question, and you can only do one thing at a time, because they are testing you on whether or not you can prioritize and do the first thing first. So the nurse is caring for the client with angina who begins to experience chest pain. The nurse administers a sublingual nitro tablet as prescribed. The pain is unrelieved. Select the action the nurse should take next. Call the family, reposition the client, administer another nitro, contact the physician. Okay, so we got a nice little variety on that. Okay, so this is going to be building on your knowledge of how nitro is specifically ordered. And the order is written in the vast number of times, almost 100% of the time, the patient is going to get something like 0.4 milligrams nitro sublingual, PRN chest pain, Q 5 minutes times 3. So you know that the patient can get 3 doses, 1 every 5 minutes. If they don't get, the pain is relieved. So how do you know? The correct answer here is administer another nitro. You know that you can give another nitro because the patient begins to experience chest pain and the nurse administers a sublingual nitro. And so you know that they can get 2 more if the pain is unrelieved. So it's not reading into it. It's reading what the question is actually telling you. They just started having chest pain. They got 1 sublingual nitro. They can get another in 5 minutes if the pain is unrelieved. So number 3 is your correct answer. Determine if it's a true or false option question. So these are the questions that usually have as part of their wording something like, how would you know that additional teaching is required? You've taught XYZ to the patient. What statement by the patient indicates the need for additional teaching? Or you observe someone doing something, and what action by that person indicates the need for you to intervene because they're doing something wrong. So essentially what you're doing on false option questions is that you're picking the wrong statement or the wrong action as the correct answer to the question. So it requires you to kind of flip your brain backwards and not pick the quote unquote correct answer, pick the wrong answer. So the best way to do this as you're looking at false option questions is look at the answer to the question and ask yourself, is this true or false as it relates to the question? So let's look at an example of that and see how we can keep our brains straight. Patient has an order for a vest restraint from 10 p.m. to 7 a.m. because he's confused and tries to get out of bed. What observation by the charge nurse at 11 p.m. indicates the patient's nurse has performed an unsafe action? So basically what you're going to do for this question is you're going to look at all the options and you're going to ask yourself, is this a safe action? And if it's a safe action, you're going to mark it true. And if it's not a safe action, you're going to mark it false. And hopefully you'll come up with 3 true answers and 1 false answer. That's your false option. That's the correct answer to the question. So let's kind of do this one and see how we do on it. Okay, so we got a little variety of answers here. Okay, so you've determined that it's a false option question. So you say, okay, you're looking for an unsafe action. So I want to find out what are the safe actions, mark those true so that I can identify which is not safe. So is it true that a safety knot should be used to secure the vest? Yes, that's true. It is true that the record says to release the restraint every 2 hours. That's protocol when you're using restraints. So that's true. That's not an unsafe action. The call light was in reach of the client. Yes, that's safe. So that's true. But the restraint was applied tightly. That is not a safe action. That is the false option. So that's the correct answer to the question. Principles of therapeutic communication. Oftentimes your questions are going to say, the patient says XYZ, what is my most therapeutic response? So let's see how we are going to be answering this question using our therapeutic communication techniques. The mother says to the nurse, I'm afraid my child will have another seizure. Select the most therapeutic response for the nurse to give the woman. Please tell me why you're concerned. Most children will never experience a second seizure. Tell me what frightens you most about the seizures. Acetaminophen can prevent another seizure. Okay, so this is usually how I have it. Most people know that, number 2 is incorrect. That doesn't mean, that's totally a false statement. And number 4 is incorrect. But the number 1 and number 3 kind of are questions that you might ask in conversation that would kind of elicit the information that you're trying to gather. However, the word why should not be used for therapeutic communication. The word why tends to put people on the defensive, makes you appear to be confrontational. Now, we're talking NCLEX land, we're talking principles of therapeutic communication. In most situations, people are not going to become defensive if you ask them why. But think about maybe that psychiatric patient who's experiencing certain symptoms and they have a chemical imbalance in their brain. They don't have a clue as to why they are feeling or thinking or hearing or seeing the things that are happening to them, and would become very defensive and concerned if you were asking them why. But if you ask them, tell me more. Tell me what frightens you about the seizures. She's afraid, so you're validating her fear and saying, what is it exactly that you're afraid of? And that way you can now identify what the problem is and address those fears. But avoid the word why when you're answering an NCLEX question. Eliminate the similar, pick the one that's different. So sometimes they all kind of blend in, but one of them might be a little different from the others. What was that on Sesame Street? One of these things is not like the other. So see if you can figure out what's the best answer to this one. Oral levothyroxine, 50 micrograms daily, prescribed for a client with hypothyroid. Select the time at which the nurse tells the client to take the medication. Just after breakfast, with a snack, before breakfast, after supper. Okay, so we're all over the place with this one. So many times, you learn about certain meds, you may have looked them up, because you're giving them to your patients, but it's hard to remember which have to be given on an empty stomach, which should be, can't be taken with milk. There's a lot going on. So use the process of elimination with this one. If you don't know that Synthroid, levothyroxine, has to be given on an empty stomach, and it's usually given early in the morning. So number 1 involves food just after breakfast. Number 2 involves food. Number 4 involves food. So you got food in your stomach. So if you look, the only one that doesn't involve food in the stomach is before breakfast. So eliminate the ones that involve food, pick the one that doesn't. So 3 is your correct answer here. Eliminate absolutes. Sometimes, and you've got it down to those 2 kind of good looking responses, but one of them will have one of these absolute words: all, always, never, only. That will tend to make an answer incorrect. So avoid the absolutes. Look for an umbrella or global option. Sometimes all of the answers seem they fit and they all seem very similar, but some of them are more specific and kind of limiting. And another option might be more of a broad statement that kind of encompasses the concepts that are in the other options. Go for the umbrella or global option. So here's an example of that. The nurse understands that the overall aim of therapy for a client with cerebral palsy is to improve muscle control and coordination, correct the underlying cause of the disease, prevent contractures and emotional disturbances, maximize the client's assets, minimize limitations. We got a lot of variety on this as well. So you can look at this and say, okay, yeah, improve muscle control and coordination. That would be an aim of therapy for the client with CP. Number 2 is incorrect. We can't correct the underlying cause of the disease. It is something that happens during the birth process. So 2, we would eliminate right off the bat. Prevent contractures and emotional disturbances. Yeah, that would fit too. So now you've got 2 options that you're looking at and saying, I really can't use any prioritizing strategies to pick out which is better than the other. And now look for our broad global option: maximize assets, minimize limitations. So it encompasses the concepts that are in the other 2 good-looking responses. So number 4 is the best answer because it's the global umbrella option. Use delegation guidelines. And you're going to have a lot of information as you go through the program talking about delegation. The RN is responsible for the nursing process. So initial assessments have to be done by the RN. The RN has to set up the plan of care, including setting up teaching plans of care. RNs on the NCLEX have to do the administration of IV meds because LPNs in some states are not allowed to do IV piggyback or IV push. They can manage IV fluids, routine IV fluids, so you could delegate patients that have those to an LPN. But if there's an IV push or an IV piggyback, that cannot be done by LPNs in some states. And the NCLEX is a national exam that is normed for national restrictions. So RNs are responsible for the nursing process. You can do the initial assessment. And then you can delegate the gathering of data to the LPN. LPNs gather data to contribute to the assessment. The RN is responsible for the assessment itself, because the assessment is a broader concept. It involves analyzing all of that data to come up with an impression of what's going on with that patient. So you can delegate the gathering of follow-up data to the LPN, but the initial assessment has to be done by the RN. UAPs, unlicensed assistive personnel, are going to do most of our non-invasive interventions. However, they are trained to do certain interventions that are okay to delegate, things like blood, finger stick blood sugars, that sort of thing. But on an NCLEX question, look at it as an academic exercise and just think to yourself, if it's a complex, unstable patient, they've got IV meds, things like that, has to go to the RN. It is not an insult to the LPNs that they're not intellectually capable. You're just looking at scope of practice. You can delegate follow-up assessment, gathering follow-up data to the LPN. You can delegate continuing on with a teaching plan and reinforcing a teaching plan that you've set up as the RN. LPNs can give PO meds, they can give sub-Q, IMs, intradermal, eye drops, topicals, all that stuff LPNs can do. But on NCLEX, you're not going to delegate IV piggyback or push. The patient has chronic obstructive pulmonary disease. Which intervention for airway management should you delegate to a nursing assistant, PCT, UAP? Assisting the patient to sit up on the side of the bed, instructing the patient to cough effectively, teaching the patient to use incentive spirometry, auscultating breath sounds every 4 hours. Yes, that is the only thing of these that you can delegate to the UAP. Instructing the patient to cough effectively, the RN has to do the initial instruction. The LPN could do follow-up reinforcement. Again, with the teaching to use incentive spirometry, the RN is to teach that patient, and now the LPN can follow up with any advice or reminders. The UAP could remind the patients to use their incentive spirometry. They just can't instruct on the use of it. Auscultating breath sounds every 4 hours. Once you do your initial assessment, you could delegate that to the LPN as well. Select all that apply. Don't we all love select all that apply? The nice thing, there are some select all apply in next gen that actually tell you select the 3 priority things that you're going to, so you know that there are 3 things to pick, or select the top 5 things or the first 5 things that you're going to do. But there'll also be the traditional select all that apply. Well, they'll just say select all that apply, and you've got to figure out, it could be one of the options, it could be all of the options, or it could be anything in between. So there will always be at least one that applies, and it could be all of them. So what you need to do with select all that apply is look at each option individually and ask yourself if it's true or false as it relates to the question. So let's do one. On this one, you're going to be typing in what the A, B, C, D, whatever letters apply that you think are the good answers for this. Just type them into your Pear Deck. The client's having difficulty with motor aspects of speech, difficulty forming words, has a nasal tone. Select all of the communication strategies the nurse would use when working with this client. Repeat what the client said to verify the message. Encourage the client to speak quickly, not continuously while the client is speaking. Engage the client in lengthy discussions to strengthen the voice. Ask questions requiring a yes or no response. Use a letterboard or a picture board. So type in the answers that you think are the correct answers for this, and then we'll talk it through. I see AEF, AE, AEF. So somebody's going to get partial credit. So look at each option individually and then ask yourself, is it true or false as it relates to the question? Because it could be a true statement in a different situation, but not be true in this situation. So In this situation, should you repeat what the client said to verify the message? True. In this situation, should you encourage the client to speak quickly? False, because they're having difficulty forming words. That would be very frustrating for them. Should you nod continuously while the client is speaking? No. Continuously, again, we have an absolute. Would that not drive you crazy if somebody, while you were talking to them, would just kept nodding at you? It'd be very distracting. Engage the client in lengthy discussions to strengthen the voice. Not in this situation, because they have difficulty forming words. Ask questions requiring a yes or no response. Yes, that is true. Now, all of your teaching on therapeutic communication tells you, oh, always ask open-ended questions. But in this situation, open-ended questions are going to be difficult for this patient. So yes or no responses are going to be, yes or no questions are going to be better. So E is correct. And then F, use a letter board or picture board. Yes. So A, E, and F are the correct ones. The nurse is assessing for peripheral neurovascular dysfunction after knee surgery. What parameters should the nurse assess and document? Select all that apply. The color of the patient's lower leg and foot, the ability to move his foot, his sensation in his foot and lower leg, the temperature of his foot and lower leg, the presence or absence of hair on his lower leg. I have A, B, C, D, A, D, E, A, B, so a lot of partial credits. That's another good thing with the next gen NCLEX, they give you partial credit for select all that apply questions. So the keywords in this, we are looking for peripheral neurovascular dysfunction. So our neurovascular assessment, our CMS, our circulation motion sensation. So we are going to be assessing the color of the lower leg and foot, their motion, the ability to move the foot, their sensation in the foot and lower leg, the temperature of the foot and lower leg. Those are all part of that circulation motion sensation peripheral neurovascular assessment. The presence or absence of hair on the lower leg has nothing to do with their neurovascular function after knee surgery. That would be something that might be shown if the patient has peripheral arterial disease. So they're not, their hair, they've lost the hair on their lower leg. So A, B, C, and D are the correct answers here. Changing answers. If I was doing this in person, I would ask you to raise your hand if you've ever changed answers on a question. The nice thing about all of our exams, once you get around, I think the middle of nursing 200, all of our exams are forward only, just like the NCLEX. So you can't go back and change your answers. You could always change it before you move on to the next question, though. Be really, really careful. Change your answer only if you are 100% confident that you clicked the wrong answer, not where you're going, oh, maybe they're trying to trick me. That was too easy. I should probably pick something different. Don't do that. Go with your strategies and don't change your answers. Another strategy, cover your answers. So the scenario is kind of like this. You start reading the question, you get halfway through the question, and you say, oh, I know where this is going. And you jump down to look at the answers without reading the rest of the question. And an answer will jump out at you as like having a lot of buzzwords that your professor has talked about in class and just looks good. But you haven't read the whole question. And you could very well have missed some keywords in that question, things like accept or not, if they're asking you about something. So you go back and you say, wait a minute, I got to go back and read that question. But you've already landed on an answer that really looks good to you. So now when you go back to finish reading that question, there will be a tendency to change the meaning of the question to fit the answer that you fell in love with. If you've done that in the past, and I know I used to do that because I always wanted to just rush through an exam, take a scrap paper, cover up the answers on your computer, read the entire question, every single word. Don't go popping down to look at those answers. Cover them up with your scrap paper. Try to formulate what you think might be a good answer to the question, then uncover the answers And the answer that jumps out at you will probably be very similar to the one that you kind of hypothesized would be a good answer for that question. But read every word. I can't count the number of people in my class that, got a question wrong because they didn't see the word not or except when they were reading it. Medications. NCLEX will only give you generic names. So you need to be able to know medication categories. There are very common names, common meds that are going to be coming up on NCLEX, and we are highlighting those as we're talking about our various content medications in our courses. But things to remember when you're reading an NCLEX question, if the option says, the client says, oh, I'm going to just stop taking this med because I'm feeling better, that's a wrong response by the patient. You can't recommend even over-the-counter drugs unless you have orders for it. So unless the question says you're working off of standing orders and you have an order for that, you can't recommend that. You're never going to give the med when the order is difficult to read, unclear, or an abnormal dose. So there will be very common meds that you'll be giving on a regular basis during clinicals that make note of the dose, because that could come up on a question. If you've never seen the med before and there's a medical diagnosis in the scenario, try to link that with the med. If you know it's a respiratory disease based on the description, then the med they're talking about is probably a respiratory med. And so what are some of the things that you know about other respiratory meds that you could link with that? Look for commonalities in med names, identify the classification. The prils are the ACE inhibitors, the olols are the beta blockers. So learn, your general names and endings and prefixes and suffixes to their medications that will help to identify the classification. And then you can say, okay, I know what the side effects are for ACE inhibitors, so I can apply that to the question, things that I'm going to be worried about. And finally, when all else fails, look at the med name, use medical terminology to help determine the action. That worked a lot better when they used to put the trade names in, because a lot of the trade names they come up with that they kind of mirror what types of things that are that it's treating. When in doubt in real life, you're always going to be looking up your medications. So unfortunately, on the NCLEX, there are a few that you might need to struggle with. So we've got time. Yeah, looks like we've got a few minutes. We can do a couple more questions. We've got an 18-year-old who had surgery yesterday for repair of a right torn rotator cuff. Although Demerol 75 milligrams is ordered Q3 hours PRN, the patient has refused the medication since surgery. During the morning rounds, the nurse notices that the patient's teeth are clenched and he's diaphoretic. Which of the following actions by the nurse is most appropriate? Administer the Demerol 75 milligrams as ordered. Explain that taking the medication will not lead to drug addiction. Ask the patient if he's experiencing any pain. Ask the patient why he's refused the medication. Okay, so we got a nice little variety here. We can't do number one because that's assault and battery. If they're refusing the med, you can't just give it. We're assuming with option number two that he's concerned that the Demerol is going to lead to drug addiction. We have no clue in this question that there are, that there's that fear. Ask the patient why he has refused the medication. Remember, avoid the word why. Ask the correct answer is ask the patient if he's experiencing any pain. Now you can say, oh, well, by his, nonverbal actions, it appears that he's in pain, but you need to identify, is he in fact in pain? If he says in real life, now let's go out of NCLEX land, you've asked him if he's experiencing pain. He says, yeah, I'm in a lot of pain. At that point, it probably would be appropriate to use the word why and say, hey, well, if you're having a lot of pain, why won't you take the pain medication that the doctor has ordered? And then in that course of that conversation, maybe he will ask questions about drug addiction and you could explain about that. But you can't assume. You need to identify, assess first, ask him if he's experiencing pain. Patient was told he needed to have an exercise stress test after having several episodes of chest pain. When the nurse enters the room, the patient says, well, maybe I shouldn't bother having this test and just take my medications instead. What's the nurse's best response? Can you tell me more about how you're feeling? Don't worry, emergency equipment will be available during the test. Most people tolerate the procedure well without any complications. Don't you really want to control your heart disease? Yeah. Can you tell me more about how you're feeling? I would not feel very comfortable if the person said, oh yeah, well, we'll have, we got the crash cart in case there's a problem. That, not too good. Same thing with that. I wouldn't feel very comfortable after that. And that's the number 4 is very confrontational. So I am going to stop sharing. I believe we are still recording. Are we still recording? Yes, we are still recording. So I'm going to kind of, close up on this one, but I will be sending out the link to your course coordinators to post on Canvas. So anybody that couldn't make it or wants to see this again can certainly do that. And does anybody have any questions for me before we close off the session? Okay, so I'm going to stop the recording here.